Good evening, that's it. Good evening, everyone. It's 6:30 and we will start. For those of you I haven't met, I'm Richard Haddock. I'm the chair of the board of the St Vincent's Curran Foundation, and it's very much my pleasure to welcome you to tonight's Inside St Vincent's event, celebrating 50 years since the first bone marrow transplant at St Vincent's Hospital. I'd like to begin, This looks good. I'd like to begin by acknowledging the traditional custodians of the land on which we are, the Gadigal people of the Eora Nation, and pay my respects to elders past, present, and emerging. A very special welcome to the Sisters of Charity joining us both online and in person, and in particular I mention Sister Deirdre Hickey, who last week celebrated her 70th year as a sister. So quite an event. Welcome also to our St Vincent's Curran Foundation trustees and board members, and especially Charles Curran, the chair of the trustees of the St Vincent's Curran Foundation. Thank you, Charles, for being here. To our foundation supporters and St Vincent's Hospital colleagues, and particularly those from the Department of Haematology, thank you also for joining us. And a warm thank you to our panellists who will be more formally introduced shortly, and of course Sophie Scott, journalist and author, for lending her expertise to facilitate this evening's discussion. I'd like to take this opportunity to specifically acknowledge Dr. Sam Milliken. Dr. Sam is there at the front row for his outstanding 35 years of service at St Vincent's, including 10 years as the Director of Haematology and Bone Marrow Transplantation. They love you, Sam. Many of the advances you'll hear about tonight happened under Sam's leadership, and we thank Sam very much for the contribution he's made and look forward to hearing from him later. Tonight we come together to mark 50 years of groundbreaking haematology and cellular therapy achievements at St Vincent's, much of it only possible through the generosity of donors to the St Vincent's Curran Foundation. We'll hear from an exceptional panel of past and present clinicians who have shaped this history and continue to drive its future. Since performing Australia's first bone marrow transplant in 1975, community and donor support has been vital in helping us fund innovation to ensure we stay at the forefront of care. Between 2015 and 2017, to mark the then 40th anniversary, generous donors gave $7.3 million, enabling the redevelopment of the St Vincent's Haematology Blood and Bone Marrow Transplant Ward in 2017. In this regard, special thanks to our major supporters, including the Naloon Foundation, Arrow Bone Marrow Transplant Foundation, and Dr. John and Mrs. Anne Chong. In the past 6 years alone, your generosity has provided a further $7.7 million to drive innovation and translational research, establishing St Vincent's as a national leader in stem cell transplantation for malignant and autoimmune diseases. As we celebrate this milestone, we look to the future, a vision to create a centre of excellence in cellular therapies, accelerating research and improving patient care. To achieve this, we need to raise $14 million over the next 3 years, supporting, in fact, 4 key priorities. A patient access fund to assist vulnerable rural patients with accommodation during treatments, education scholarships and international exchange programs to attract and develop the best talent and learn from international partners, a suite of next-generation equipment and technology, and expansion of our research and clinical trials portfolio to benefit patients here at St Vincent's nationally and, in fact, globally. Your continued support ensures St Vincent's remains at the cutting edge of this rapidly evolving field, saving lives now and into the future. Thank you for being part of this remarkable journey. We hope you leave here tonight feeling inspired to bring this vision to life. It's now my pleasure to invite Dr. Sam Millican to the stage to also welcome you and to introduce our panel. Sam.
Thanks, Richard, and good evening and welcome, everyone. First, can I also acknowledge the traditional owners of the land on which we meet tonight, the Gadigal and Bidjigal First Peoples of the Eora Nation and their elders past, present and emerging. It's a great pleasure to welcome you all tonight as we commence the celebrations of our 50th anniversary of our very first bone marrow transplant, a milestone that's transformed many lives. Professor Jim Biggs, who we sadly lost only 2 years ago, was responsible for developing the Haematology department at St Vincent's 55 years ago. And as we will hear tonight, had the foresight to initiate transplantation at St Vincent's and in Australia 5 decades ago. At this point, could I also acknowledge the past contributions of Professor Kerry Atkinson and Dr. Alan Concannon, who we sadly lost Alan earlier this year. Now, I've been privileged and honoured to be a part of this department for 35 of those 50 years. And I'd also like to acknowledge the tremendous support we've enjoyed from the Curran and also the Arrow Foundations for BMT and from all our donors who've helped make our success a reality. We wouldn't be here today without the generous philanthropy of donors, from multiple modest contributions through larger generous contributions. We've realised the creation of a multi-million-dollar state-of-the-art inpatient ward, as Richard mentioned, as well as provision of up-to-date medical equipment that enables us to provide the safest care and comfort to our patients. We've realised the creation of our Cellular Therapies service and been able to remain at the forefront of both laboratory-based and clinical research. In my 10 years as Director of Haematology and Bone Marrow Transplantation, I've witnessed and been part of remarkable progress. Haematology has firmly established itself on the St Vincent's campus as a national leader in stem cell transplantation, not just for malignant disease, but as we'll hear, also for severe debilitating autoimmune diseases. We've worked together as a family of doctors, nurses, allied health professionals, and not least our patients and our supporters. And together with the support of our public and private hospitals and the St Vincent's Clinic, we've driven innovation, we advanced bench to bedside translational research, which have all contributed to much needed and vital patient care. And this has not only been here in Sydney, but also in our rural and regional clinics, mainly in the southwest of the state. We've also been recognised as the statewide service provider for stem cell transplantation for severe autoimmune diseases. We've been steadfastly committed to research, and this has grown stronger through international partnerships with world-leading institutions, including the Dana-Farber Cancer Institute in Boston and University College Hospital in London. These collaborations allow us to remain at the forefront of discovery and implementation of new therapies. Ultimately, what matters most are our patients. Every step we take is to ensure they receive the best possible care and that their families feel supported through undoubtedly the most difficult times in their lives. This is gratefully enabled and improved by our donor-funded research and clinical trials programs. And to all our supporters here tonight, a very hearty thank you. These achievements would not be possible without your generosity. What I'm most proud of, however, is our people, our nurses, clinicians, allied health professionals and support staff, many of whom are here this evening. Their expertise, dedication and compassion provide immense comfort to patients and what is often a long and challenging journey. Now, it's now my pleasure to introduce my colleagues, past and present, who will take us on a journey from our beginnings, through our achievements and onto our hopes for the future. It's my great pleasure to introduce Dr. Barbara Withers, who's now our Acting Director of Haematology and Bone Marrow Transplantation. Barbara is a clinical and laboratory haematologist with a deep commitment to advancing patient care for haematological cancers in haemopoietic stem cell transplantation and what's called adoptive T-cell therapy. Barbara is also at the forefront of translational research, including trials using autologous stem cell transplantation for patients with multiple sclerosis and virus-specific T-cell therapy to prevent or treat post-transplantation infections. Work that's helping to shape the future of patient care. Oops. Pages are sticking together. The next one's important.
Let's give Barbara a round of applause while
Okay, it's now an honour to introduce Associate Professor Tony Dodds, a name synonymous with the history and success of haematology at St Vincent's. Tony's dedicated 51 years of service to St Vincent's, initially as a medical officer, then a staff specialist, then a senior staff haematologist, and he preceded me as our director, retiring only in 2023. Tony's taught me and others a great deal. He was a member of the pioneering team that performed the first bone marrow transplant at St Vincent's, a milestone we're celebrating tonight. In 1996, he was appointed Director of Clinical and Laboratory Haematology and Bone Marrow Transplantation. And beyond St Vincent's, he's co-chaired the New South Wales Bone Marrow Transplantation Network and was Vice President of the Bone Marrow Transplant Society of Australia and New Zealand. He's also been a long-standing chair of the Arrow Bone Marrow Transplant Foundation. Next, it's my pleasure to introduce Dr. Jennifer Massey, not a haematologist, but a staff specialist neurologist here at St Vincent's, whose expertise lies in multiple sclerosis and neuroimmunological diseases and the role of cellular therapies in their treatment. Jennifer reflects our success in applying our cellular therapies research program to other non-haematological diseases. Jennifer leads a number of groundbreaking translational research programs, including our flagship initiative using stem cell treatment for MS and other autoimmune diseases, a program that continues to set new standards of care. Lastly, Professor John Moore, our Chong Family Director of Cellular Therapies. It's my privilege to introduce him. He's a senior staff specialist in our department and a Professor of Medicine at the University of New South Wales. He's a leader in the field of cellular therapies, and it's been my good fortune to have worked with John for more than 20 years and shared in his achievements. Since July 2021, he's served as the Chong Family Director of Cellular Therapies at St Vincent's and is a conjoint professor, as I mentioned. John's primary focus is stem cell transplantation, with a special interest in transplantation for autoimmune diseases. So now, please welcome everyone. So that's me done, and I'll now hand over to Sophie Scott.
Thank you. And everyone give Sam a big round of applause. Thank you, Sam. Thank you so much. Thank you for the great introduction. It's a pleasure for me to be here tonight on this great celebration. I've hosted lots of Inside St Vincent's, but this one seems very special. There's a real sense of celebration in the air. I can feel it, and you can feel that sense of comradeship amongst all of you, doctors, clinicians, patients, and it's fantastic to be here. We're very grateful you've taken the time, given up your valuable time to be in the audience tonight, and it really says to us that you value science, you value making a difference, and you value being of service, and that's what St Vincent's is all about, making a difference in people's lives. As we've heard, it was 50 years ago, it was the first bone marrow transplant in Australia's history, which is absolutely fantastic, and you're going to be hearing tonight how St Vincent's has built on that legacy through these experts. You're going to be hearing what they've done and what we're hoping to do in the future. So I want to start with the fundamentals. Let's hear from Barbara first. Can you take us basically through what haematology is? Some in the audience will know, but some won't, and why it's just such an important part of medicine.
Yeah, I would say some of our patients who are here are experts in haematology. So haematology is the study of blood cells, the bone marrow where they're produced, and the lymphatic system. So the three main blood cells that are produced in the bone marrow are the red cells, which carry oxygen, and the white cells, which are part of the immune system, and platelets, which are the cells that clot the blood. So broadly, we look after patients with non-malignant haematological diseases, so things like anemia, where their red cells are low, things like iron deficiency, iron overload, which is sometimes called hemochromatosis, where blood cells are being broken down, hemolysis. And we also look after clotting disorders like DVTs and bleeding disorders like hemophilia. But the vast majority of the work we do here is actually all about blood cancers, unfortunately. We look after patients with leukemia and myeloma, which are cancers that arise in the bone marrow. And we look after lymphoma, which is cancers that arise in the lymph nodes. Blood cancers are a big problem in Australia. We currently have about 140,000 people living with blood cancer in Australia right now. There's about 20,000 people who are diagnosed every year with blood cancer, and scarily, there's been a 47% increase in the last 10 years in the incidence of blood cancer. Blood cancers can be life-threatening. They often need immediate treatment. Patients will go from feeling relatively well, have something picked up on a blood test, and by that evening they're in our ED and they're needing treatment with chemotherapy within a couple of days. And our chemotherapies make people very sick, unfortunately. And in fact, more people die of blood cancer each year than breast cancer and melanoma combined. So it's a really significant issue. The good thing is we can cure patients with blood cancer, and honestly, that's what we're all working for in every single patient that we see. Patients can undergo this procedure called a bone marrow transplant, and we're going to hear a lot more about that tonight. It's a really arduous process for them. They'll often spend 6 months here, the first month in hospital being incredibly sick and incredibly unwell, and then 4 or 5 months close by the hospital where they're needing blood tests, they're on a lot of medications, and they're really unwell. We also have a large number of patients coming from Murrumbidgee, which is one of our referral services. So from Wagga and Griffith, about 25% of our patients are coming from the Murrumbidgee, and that puts an extra added pressure on them. They're here away from their families and their support systems, and they're dealing with something that's really scary. And it's hard, being there and looking after people, but that's what we're here for, and that's what our really dedicated team are here doing.
Amazing, and we'll hear more from you, Barbara, soon. But Tony, I just wanted to talk to you and maybe go back a little bit. We're honoured to have you here, given that you were part of the team that performed the first bone marrow transplant in Australia at St Vincent's. Can you tell us a bit about that? How did it come about, and what were the challenges that you faced in doing the first couple of procedures?
Yes, well, I'm obviously the grandfather of the group here, so...
We're very privileged to have you.
Yes. Well, I guess I was a registrar when the first transplant was done, and Jim Biggs, the iconic Jim Biggs, who I'll say a little bit more about later, was the director of the department. His impetus as an entrepreneur and an enthusiast to get this whole process going. And the initial reason for wanting to start the program was to treat leukemia. Now, we're going to hear a lot about some of the fancier stuff and all the new cellular therapy, and that's wonderful. But AML in that stage in adults had about a 5 to 10% survival rate with intensive chemotherapy, and that just clearly wasn't enough. So there was a move.
So what years are we talking about?
We're talking about in the 1970s.
70s and
before, in about the 1970s, before transplant became an option. So that was the impetus to do it. Now, bone marrow had been used therapeutically in sort of rather strange ways. People infusing it just into bone marrow, into the bone or into people's eyes or other parts of the body. It was a complete failure. So the impetus of this area became much stronger when the atomic bombs were dropped in Japan in August 1945, and the anniversary was only last week, the 6th of August. Happens to be my birthday, actually. When Hiroshima, the bomb was dropped in Hiroshima. And people who weren't immolated immediately in the zone of the bomb, the ones who survived that, they then died of marrow failure, pancytopenia, and they died of infections and bleeding. And so there was obviously, particularly the US Army was very keen, because I guess the US felt they were going to be bombed themselves at some point in the future, and I guess that might still happen. They were very keen to actually find ways of dealing with this problem. There was another radiation accident in Yugoslavia as well, where about 6 scientists died from marrow failure because of the radiation. And a guy named Georges Mattei in Paris was doing some work on trying to deal with that as well. So the group in Seattle, Don Thomas's group in Seattle and others, developed models, animal models and human models, to try and study how to deal with this bone marrow failure situation. And I'm not going to try and summarise the work too much because it's very complicated, but in the end what they developed was a way of transplanting marrow stem cells into an individual, a dog originally, or guinea pigs, and then humans, using various principles. And the principles were that the marrow had to be empty, so you had to treat the bone marrow. It couldn't have leukemia in it because then it wouldn't take. And the conditioning, the initial part of the treatment, the conditioning was also important to suppress the immune system of the recipient to allow the bone marrow to take. The next thing that was so important was that tissue typing had to be developed, so that you had to have the person who was a close match in tissue typing, usually a sibling, sometimes an identical twin, sometimes an unrelated donor. We know now there are lots of unrelated donors that donate their bone marrow around the world. And there are new techniques now using haploidentical transplants. John might talk a little bit about that, where you only have half identical, but that's a little bit beyond what I'm going to say today. So when those techniques were developed, the Seattle group under Don Thomas, who eventually got the Nobel Prize in Medicine for this work, the Seattle group began to do human studies, and in April of 1975 a seminal paper was published in which some very reasonable results were obtained in acute leukemia in remission using bone marrow transplants from HLA-matched sibling donors. And that, I guess, made Jim enthusiastic about maybe we should try and get that process going in Australia, particularly in Sydney. Now, it took a little while of enthusiasm to get the whole process going. And another very important part of the way that was dealt with was by having an association with the Seattle group. There was, many of us had visited Seattle. Jim had gone earlier on in that decade, and most of us had travelled across to Seattle and made contacts there, so we knew the people involved. And there was a haematologist there named Len Johnson, who was an Australian. He actually was a resident at St Vincent's, and he went and worked in Seattle. He was a paediatrician, and he helped us get the whole process going. He managed to obtain from us the needles. We used to aspirate bone marrow with needles from the hip bones. And he got those needles for us, and he came to theatre the first time we had to do it. It takes about 2 hours. It was an incredibly boring procedure where you have to stick needles into people's back and aspirate bone marrow out. Only worse for the poor recipient, I'm sure. But then that was done, and he got the whole process going. And so we maintained the contact with Seattle. Len helped us with the early transplants by taking us through some of the procedures. We were able to contact them in Seattle. And ultimately, Kerry Atkinson joined us in 1981, and he was on the staff. He was a British oncologist who had trained in bone marrow transplant, and he made a tremendous difference to our transplant program. So the whole process started in 75 and 76, and with some early mishaps with infections and things, the first successful transplant was a man named Philip Flynn, who had aplastic anemia. He did extremely well. There was one problem. Because the ward we used was in the Cameron wing. Jim was an entrepreneur and an enthusiast, and the Cameron wing was where the first heart transplant was done. And we managed to purloin a ward in the Cameron wing called Trop Med. It was for the American servicemen who developed malaria in the war and came to Sydney and ended up in hospital with malaria. But he managed to grab that as the haematology ward, and that's where the first transplants were done, over in that Trop Med. And it was interesting because upstairs, the heart transplants were also done at later times. So there was a bit of an interest in that ward block then in terms of doing the transplants. So the transplants from there became quite successful. We did more and more. And I just wanted to talk about the sort of important components that made this happen. I've mentioned the Seattle Association. This program was completely unfunded. The thought of putting in a business case as people would do nowadays was unheard of. The only way to do this was to start doing it and hope to God that you get the fundings from the hospital and get the rest of the hospital to take this on board. And I don't think they realised how much work was involved in doing a bone marrow transplant. Just about every department in the hospital had a role to play. And I'm not going to be naming all these departments, but I'd like to thank them all, because without the help from the nursing staff, the laboratory staff, the stem cell laboratory, the pharmacy, radiotherapy, all those people did this as extra work from their standard work they were doing to make this process happen. And the other thing, of course, was the funding. And again, as Sam has already said, philanthropy was an essential part of this whole process. So Leslie Curran, who was the Chief Justice at that time, when he died, he left a bequest to us in his will, and some of the legal fraternity and his friends also donated money to the hospital at that stage. Jim Biggs, my predecessor as head of department, he decided he would go and see Kerry Packer and ask him for some money. Now, I'm sure some of you know that Kerry Packer was a bit of a character, and I remember being in the department when Jim left to go and see him, and he was really quite nervous about this. And he went to Kerry's office, and Kerry's secretary ruled the roost there. She was the one who handed out his cigarettes at regular intervals. When he pressed a button, she'd bring a cigarette to him. And she ushered Jim in, and Kerry said to him some words to the effect, "What do I need to give you to get you out of here?" And Jim said, $100,000. And he said, "Okay, I'll give you the $100,000, but don't tell Bishop Muldoon, Bishop Muldoon. Don't tell Bishop Muldoon, because he's after some money as well." So Jim left and came back, and he was really quite downcast when he came back. He said, "God, I should have asked for $200,000. I would have got that." Anyway, all that helped. And of course, the friendships from people in the hospital, and also from people who were supporters of the hospital. And Charles Curran was one of those supporters. And Charles, right from the very beginning, before the St Vincent's Curran Foundation was established, was a strong supporter of Jim. He was a friend of Jim's, I understand, and supported us all the way through this long process of ups and downs as the transplant program was finally established. So I do want to thank that, and I think that also the Arrow Foundation, the Arrow Bone Marrow Transplant Foundation, I wasn't their chairman, I was on the board for a number of years, and they're a wonderful organisation. They were started off by ex-patients of ours, and they've now spread to involve themselves with the whole state, and they support transplant recipients and nurses with scholarships, and they fund research and things like that, and I'd like to give them credit as well. So I think that's all I want to say.
Amazing. Thank you, Tony, for that amazing summary. So you've heard about the amazing history and how we got to this point, and John, I'll turn to you now as the Chong Family Director of Cellular Therapies at St Vincent's. Can you talk a bit about the cellular program and how it differs from traditional treatments that are out there?
Yeah, so I suppose first I'd like to thank John and Anne Chong for paying my wage. You know, they've been very visionary philanthropists here, and we're particularly close. I'm very fond of John and Anne. I suppose the current status of the stem cell transplant unit is that we're the second biggest unit in New South Wales after Westmead. We do predominantly donor transplants or allogeneic transplants for malignant disease, and that's predominantly leukemia. And so the issue with leukemia in adults is that we can often get them into remission, but we can't keep them there. And so really a stem cell transplant is about keeping people in remission, and what we want to do is cure people. And the power of the stem cell is that it does two things. It repopulates the bone marrow, but the stem cell grows immune cells, which kills off the leukemia as well. So the whole cellular therapy field has come about because of stem cells, which grow a new blood system, but also the immune cells that come from that. And so there's been a big push in the last 10 years or so to use those immune cells to get diseases into remission. And we're going to talk later about CAR T cells, which is it's just sort of an extension of that principle. The other thing we are doing here, which we're really the only unit in New South Wales and pretty much in Australia doing, is stem cell transplants for autoimmune disease. And that was actually Jim Biggs's initiative with Sam Millican and David Marr, and I was just lucky enough to come back from the UK, and it was sort of set up for me. So, you know, they did it all and I came along and did the stuff.
He's done a lot of work since then.
Too modest, John.
Too humble.
It was pretty good for me. So I came back, and so the basis of that is that what we're doing is giving people chemotherapy to kill off the immune cells that are attacking their body. With MS, it's immune cells that attack the brain or the spinal cord. With scleroderma, which is another terrible condition which has a high mortality, is where patients' immune system attacks their skin and lungs. And so what we do is actually give them chemotherapy, which is really about suppressing the immune system and killing off all those cells that are attacking their body. And when we give them back their stem cells, it's their own stem cells. And that actually grows a different immune system. And one of our areas of interest in research is to see how that immune system changes. And we have two of our scientists in the audience who do all that work. And, and that's really important because we found lots of different functions for the immune system with that. So cellular therapy encompasses both those areas for our unit in particular.
And we'll talk to Jennifer Massey in a minute about the MS work, but John, just before we move on, can you talk about how the St Vincent's Curran Foundation has also been a huge supporter of the work that you've been doing?
Yep.
And particularly with building the clinical trials program?
Yeah, so one of the advantages of working with St Vincent's Curran is I like working with St Vincent's Curran. Susan, Chris, Richard Haddock and Shantini and the team, they've been instrumental in us initially getting our new ward, which was a labour of love. We had a ward, and for some of the patients in the audience, we used to do transplants with 4 patients in a room.
Wow.
And that's quite tough, 4 patients sharing a bathroom, and it's a big risk for infection. So we got a new ward with single rooms with your own bathroom, with city views or Paddington views. And it was quite nice, and that was a huge help to us. And out of that 7.5 million, I think only 100,000 came from the state government, just saying. No one from New South Wales Health here, but there was not a lot of money from state government in that. So working with Curran has also been able to help us to get the sort of seed funding we're very grateful to donors who are in the audience who give us the money to be able to do the research that allows us to then go to New South Wales Health and say, we've done these stem cell transplants for MS, scleroderma, leukemia. Can we have some more money, please? Because there's a huge need for this sort of stuff. So unless we can say that we can do it with the generosity of donors, then we can't get to the next step. And we've seen that now because we've been awarded a statewide provider for scleroderma and autoimmune. And our transplant numbers for donors has gone up. I mean, Barbara and I, just looking at the numbers, we did 58 donor transplants last financial year, which is the highest we've ever done.
Wow, amazing. So it sounds like it's just growing and growing. So Jennifer, you're a neurologist working in autoimmune diseases like MS. Can you explain to the audience the impact that cellular therapies have had in that field? John touched on it a bit. Can you expand a bit more?
Yeah, absolutely. Yeah, and a bit out of place. I feel like it's like Babe, like the pig with the sheepdogs. As John said, although MS is a neurological condition and scleroderma classically thought of as sort of a rheumatological condition, these are all autoimmune diseases. So when the body's own immune system essentially goes sort of rogue and starts to attack, the relevant organs. So in MS, obviously the brain and the spinal cord. And there's obviously a large overlap with haematology because that is, as Barbara outlined, the foundation of where our immune cells develop. And so for a long time in MS, we had a lack of treatments that could protect individuals from attacks and therefore protect people from disability. And it's been now over 30 years since the first stem cell transplant was performed for MS. So as John outlined, this principle of trying to get rid of the self-reactive immune system and regrow a new and ideally more tolerant immune system. And so that was the sort of foundation of the use of cellular therapies in MS. And the first transplant in Australia was performed here at St Vincent's for MS in 2010 with John and another colleague of mine, Ian Sutton. And the program has really exploded from there. And so we've obviously, as we've all touched on, been incredibly well supported by the Curran Foundation. Specific to MS, we've been very well supported by MS Australia to try and establish this program, again, in the absence of kind of retained state government funding, to be able to offer this essential service for individuals with aggressive MS. And we've also received a lot of philanthropic support. I know the Guth Family Foundation, who are here today as well, have been very supportive of the MS program. And so this idea of using your own immune cells to treat or to reset this dysregulated immune system has so far been highly effective in MS. So for people with relapsing disease, we see periods of remission from relapses for more than 8 years in large proportions of individuals. Over 90% at 5 years are completely stable from their MS. And so we're now trying to apply what we've learnt from the stem cell transplant space into, I guess, a more refined or more targeted therapy. And this is sort of bridging from this, pretty heavy duty, pretty toxic therapy into a more targeted and sort of immune specific form of cell therapy, which is sort of the direction I think we're going across many different autoimmune diseases.
Amazing. It sounds so interesting. And we're going to be talking about the future in a second. Barbara, I'll just go to you. We do have some patients in the audience. I want to make sure we leave time to talk to them because, like we said, it's all about the patients, and I'm so excited for you to hear their stories. But can you just share a couple of the examples of how therapies have changed patients' lives that you've been involved with? You mentioned the story about Hannah Thomas, who was on SBS.
Yeah, so Hannah was actually a patient of John's, but she really has been through all the cellular therapies that we have available. So Hannah was diagnosed with leukemia and was treated with initial chemotherapy. She then came through and had a stem cell transplant and unfortunately relapsed, which still happens in a number of our patients, and research continues in trying to make that less likely to happen. She then went on and had CAR T cell therapy, where we use hypercharged immune cells to try to fend off the leukemia, and managed to get back into remission with that treatment, which was fabulous. And each time you have another line of therapy, you're less likely to get into remission to get rid of the disease there. So we know that CAR T cell therapy at this time isn't the final answer, the final cure in most situations with acute leukemia. And she then went on to have a second transplant. And the only reason Hannah isn't with us tonight is because she's off travelling around the UK going to a wedding. So she's well enough to be doing that. And we actually have another transplant patient here with us tonight who's also been through 2 transplants and CAR T cell therapy for sarco. And we're so happy that, we are changing people's lives because they're able to go off and live the life they're meant to be living.
Amazing. And hopefully we'll go around to some of the patients before we wrap up. But John, can you tell us a bit more about CAR T therapy? I mean, some people in the audience might have heard of it, but can you explain what it is in lay terms, and what are the hopes that St Vincent's might play in getting that therapy out to more people?
So CAR T stands for chimeric antigen receptor T cells, and
you don't have to remember that, everybody. There's no tests on the way out.
So what it came from was actually from stem cell transplant, because we knew that patients whose immune system attacked their body also attacked their leukemia, and that's called graft versus host disease. So there was always this effect of the immune system killing off the leukemia. And so a group in Pennsylvania in 2011 developed this technique where you take the patient's T cells or immune cells out of their body on a machine, you put it into a laboratory, you put a gene in which switches the markers or the receptors on the top of the cell and tells the cell to go and attack a particular other cell in the body, which is a leukemia cell. And they did this in an 11-year-old girl in 2011. And she got very sick because they didn't know how it was going to work, and she got big fevers and ended up in intensive care. And eventually they worked out that it was because the CAR T cells were working so well at killing off the leukemia that it created a lot of inflammation in the body. So they're now standard treatment for relapsed leukemias and for lymphomas. And so, but one of the big issues with CAR Ts is that they're predominantly made by drug companies, and the cost is about $700,000 per patient.
Wow.
As for instance, a stem cell transplant costs about $100,000.
Wow.
So they're very expensive, but it's life-changing therapy for a lot of people, including people in this audience. But there are lots of potential applications for CAR Ts because depending on what gene you put in, it then tells you what target you're going to go to.
And what's the hope in terms of St Vincent's? Like, could we one day manufacture the cells, the CAR T cells here? Is that the hope?
Yeah, so we're very lucky to acquire 2 machines from CSL, which is a very large biotech company that had a laboratory here. And so these machines are desktop machines called a Prodigy machine. And you can actually make a CAR T in one of those for $70,000. So 10 times less. And so they can be then applied for patients with leukemias, lymphomas, but also for patients with autoimmune conditions. And what we've seen in the world in the last 12 months is this explosion of CAR T cells for autoimmune conditions. And there the principle is that you're killing off the immune cells that are making antibodies, which are proteins of the immune system that attack the body. So we think we could make those cells and then we could deliver that to patients. At the moment, we've just done the first CAR T in scleroderma and in multiple sclerosis in Australia in the unit in the last 6 weeks. Wow. So we... The
inside information you heard here first.
But they're done in conjunction with a drug company. And so what we would like, and I think what New South Wales Health would like, is to be able to make these CAR Ts more cheaply. And if they prove to be the right treatment for these patients, then we can save the public a lot of money, we can help a lot of patients, and it's going to be super interesting to do as well.
So before we move on to interview a couple of our patients in the audience, John, I'll just stick with you. We've heard a lot of very inspiring things about the work being done tonight, and people in the audience might want to, do more and help. Can you talk about the future and what you're hoping for this area, how you want to grow the department and grow the clinical trials program, and also other people that have supported the work so far, like the Tour de Cure and other family foundations? Yeah.
So we've been very lucky to have a lot of groups help us with our cellular therapy program. James and Amelia Simon have paid for a clinical trial nurse that helps us in cellular therapies for multiple myeloma. We've had Andy Price and the Bourne Foundation help pay for staff to help run clinical trials. So we've had some amazing groups, and there's lots of others, of course, that have helped us. And what we want to do is now grow and really expand our autoimmune and malignant programs. And we can see that we could treat more patients successfully with CAR T cells, for instance, in autoimmune conditions and malignant conditions, and also look at expanding our stem cell transplant program to help patients in rural and regional Australia. We now look after patients from Wollongong, the South Coast, the whole Riverina, Griffith and Wagga, Canberra, Port Macquarie. We now cover a referral base of over 2 million people. And what those patients need is somewhere to stay, help. It's a long process, and that's one of the things that we really would love help with. We want to increase our research, have PhD students to work with us on these interesting topics, and really grow the program to help patients.
And before I move on to the patients, Jennifer, I just had one other question for you about autoimmune diseases, because we know you mentioned a couple of ones where you're already working, but what's the potential to do these types of stem cell treatments for other conditions, say like lupus or IBS or other rheumatoid conditions?
Yeah, and so this has been explored, to date, both, internationally, but also here. So in addition to MS and scleroderma, before I began, John and Sam and Jim Biggs and the team had transplanted people with rheumatoid arthritis. You've transplanted people with lupus, things like inflammatory bowel diseases. And, each disease does respond differently to stem cell transplant. And so I guess the fact that we predominantly now transplant people with MS and scleroderma is a reflection of the fact that those diseases are the most responsive, but there certainly still can be benefit across those other conditions. And I suppose what we would like to do, one of the limiting factors with stem cell transplant is the toxicity, and that's been sort of touched on repeatedly tonight. And for diseases like Crohn's disease, where there's a lot of bugs that can float around from the gut and make people very unwell, that makes transplant in that setting very risky. And so this is why that kind of translational research aspect is so important, because if we can study how these therapies, it's a single shot therapy, yes, it's very heavy duty, but it's a one and done, how these therapies can provide remission of a disease for 8, 9, 10 years. If we can understand that and then apply those principles for targeted or directed cellular therapy in different conditions, then the idea is we will be able to have a far more specific and ideally less toxic therapy for these conditions that do affect people, classically in their 20s and 30s. And whilst they might not have the same risk of mortality as some of the hematological cancers, they carry a long and significant risk of disability. And so that is, that's something that's very, very close to my heart.
Yeah, amazing. Well, we're going to go to the audience in a second. Who's got the microphone? Excellent. Okay, so we've got a couple of amazing patients in the audience, so I really want you to hear their stories. So you're right next to one of the patients over there. So Lisa, can you just raise your hand, Lisa? And Lisa's sister, Lena, is here as well. Lenny, sorry. Lisa, tell us about your experience having the stem cell transplant.
6 years ago, I was diagnosed with ALL, acute lymphoblastic leukemia. I was actually diagnosed at Prince of Wales Hospital, and the hematologist who diagnosed me there sent me to St. Vincent's and told me that there's St. Vincent's is running a clinical trial and there's a lovely doctor there who will look after you. And that she thought that I would qualify for the trial. So I would like to credit this decision for saving my life. It was at St. Vincent's where I was in the care of Dr. Moore. I was put in blinatumomab, which is immunotherapy. Then thereafter, I had a haploidentical BMT, and my sister was my donor. Oh, wow. Dr. Moore and all the lovely staff at St. Vincent's and Kinghorn saved me. I was only 42, and I had an 8-year-old son. But I was very positive because I felt like I was in the best of care. The compassion, expertise, and commitment they gave to my healing was more than I could dream of. For me, St. Vincent's is a place of healing, hope, and comfort. It's a sanctuary of care where miracles happen. And from the bottom of my heart, I would like to take this opportunity to thank Dr. Moore and all the team at St. Vincent's and Kinghorn for everything that you do every day for all of us normal people. I'm now back working full-time, doing a job I love, and spending my everyday with all my loved ones. And I have you to thank for that, so thank you.
Thank you. Woo, well done. So we have have some other amazing patients in the audience. So can we go to James? Can we hear a bit about your story, James?
Well, thank you.
Thank you.
So my name is James Wilson. I was, just over 2 years ago, I was referred to Dr. Orly Levy, who diagnosed a type of particularly nasty lymphoma, AITL. So that was in May 2023. And I underwent 2 separate courses of chemotherapy, which sort of kept the lymphoma at bay, but as soon as we stopped the treatment, it came back. And after the first round, I think Orly proposed me for a stem cell transplant, and that's where I met Dr. Barbara Withers, and was proposed for a transplant, which happened in July of last year, so I'm just over 12 months since the transplant. So my day zero was the 2nd of July 2024, the sort of start of my new life. I guess for me the process was, it was pretty nasty, but I think I was probably pretty well prepared for it. Certainly Barbara had been pretty clear about what was involved, what the risks were and what the downsides were. And so I guess it didn't make it any less terrifying. But as was said earlier, the amazing thing about everybody at St Vincent's, all the doctors, all the nurses, everybody, all the support staff, all the allied health, everybody, was that it's very clear that their single purpose is, as you have said, as has been said before, is towards the patient and healing the patient. Not just the patient, but the patient's family as well. So I know that my family felt incredibly supported through the whole process. And although it was a horrible process, in many ways it was wonderful, because being exposed to such a wonderful group of people who were so empathic, so understanding, so kind. I was saying earlier that I can't think of a single occasion where somebody at St Vincent's, either projected that they'd had enough that day, or they were over it, or anything. Everybody was kind, was positive, and was helpful. And so it was an extraordinary experience for me. And I guess what I've taken from it is, here I am 12 months later, I'm still here. And it's changed, apart from the gratitude that I feel every day towards the team, it's changed my perspective on things. It really does make you realise what is important in life, and that is something that I'm also incredibly grateful for. So,
thank you, James. Beautifully said. Before we wrap up, I just want to go to our other lovely patient in the back, just behind you. He's just here with the striped top one. We've got a very special third patient I just want to hear you to hear from.
I'm a Professor Mo's patient. Thank you very much for inviting me today. I was diagnosed ALL in 2010 in St George Hospital.
That's right. And so you've had a couple of transplants, haven't you?
Yeah. I passed my husband.
Thank you so much. So for Psycho's had 2 stem cell transplants, and the first one, she relapsed after the first one, and then she had CAR T cell therapy, and then a second transplant, and she's been in remission for 3 years.
Oh,
so,
amazing.
Wonderful story. We owe so much to the wonderful people here tonight, and it's very emotional sort of times.
Thank you. We appreciate you sharing your story. Thank you so much.
Thank you so much for everything.
So we've got time for 1 or 2 more quick questions from the audience. So we've got a question down here, and then we'll try to take one from over on this side as well. Just raise your hand if you have
How do you donate stem cells or bone marrow? I sort of think of bone marrow, that you're scraping something out of the middle of your bone. I'm sure that's not exactly
So
what
if
happens.
you, as an average person, if you wanted to donate your bone marrow, how would you go about it? Who would like to answer that?
Yeah, I mean, I can, yeah, so to donate now, we take it from the blood. We used to take it to theatre, as Tony said, but the surgeons weren't happy with us going to theatre. They kept taking their time. And also, it was a much harder procedure to get it out of the bone marrow. So stem cells can come out of the bone marrow into the blood, and we put patients on a machine that takes the stem cells out of the blood, centrifuges the blood, and then the stem cells are collected in about 200 mils in a plastic bag. So that's how it's done now.
Much easier now.
Yeah, much easier.
It's really a half-day process. You get some injections beforehand, and there's very limited side effects for the stem cell donor.
So there are now 40 million people in the world who are bone marrow donors on unrelated registries. There are also brothers and sisters who can be donors. And it's very clear now that the younger the donor, the better for leukemias. And so it's now, I think the age has dropped to 40 or 35 and under. 35. Yeah, 35 and under. It used to be before. It's dropped to 35. Yeah, at the blood bank. It's run through the blood bank in Australia. And so it's now actually done by a swab on the inside of the cheek. So it's a DNA test. And so donors are usually blood donors who also are happy to donate stem cells if required. And in fact, an interesting point about the unrelated registries is that it was actually started by an Australian woman. Anthony Nolan was a young child with leukemia, and her mother started the stem cell donors registry in the UK.
Wow. So we've got time for maybe one more question. Any more questions in the audience? It's really quite hard to see here. Otherwise, well, you've been such an amazing panel. You've given us so much fantastic information, and it's been beautiful to hear the patient stories as well. So if we don't have any more questions, I might hand over to Susan Williams to say our vote of thanks. We've got one more question up the back, all the way. Come up, Susan. Come up, Susan. We'll just do this one last question while we.
Yes, I have to say big thanks to everyone on the panel, but I have a particular memory of the grandfather of medical oncology, self-confessed. And so Dr. Anthony Dodds was a dashing young man in the cell separator ward on the 8th floor of St Vincent's, where I was sitting there thinking I was half dead, which I think I looked like I was. And I remember him walking past, and here we are, 40 years later. So I would just like to say, of course, a sincere thank you for 40 extra years, and to acknowledge Professor Biggs and Kerry Atkinson, who I'm still in touch with, in his 80s now, who I ring every time it's my transplant anniversary. And so I guess what I'm sitting here thinking of is how old is the longest living bone marrow transplant recipient from St Vincent's?
It was you.
He's here.
It's probably, yeah.
Oh, yay! Amazing.
Philip Flynn, the first transplant, he lived till about 10 years ago, so he had quite a long life as well. And my friend down there actually had a transplant back, what year was that? 84.
Wow.
And he comes from, he's now
Thank you for coming tonight as
running
well.
a rural property down in Leeton, so he's, yeah.
All right, give our panel a big round of applause.
Thank you. That's a very hard act to follow, I have to say. Excellent questions, and special thanks particularly to our patients who've shared their really personal and often really challenging stories. So thanks again. Special thanks to our panel for your insightful contributions and for the incredible work that you do for our patients each and every day. And to Dr. Sam Milliken for your wonderful introduction and for your long and stellar career here at St Vincent's, and of course to Sophie for once again expertly facilitating a wonderful discussion. Tonight's conversation, I think you would agree, has been truly inspiring. We've heard about some of the extraordinary milestones that have occurred here at St Vincent's since the very first bone marrow transplant and the exciting future ahead. one that will hopefully ensure that we continue to lead in cutting-edge translational research and deliver the very best inpatient treatment and care. Consistent with our mission to provide excellence in healthcare, particularly for our most vulnerable in the community, St Vincent's remains committed to striving really hard for better treatments and the highest possible standards of care. Our deep gratitude goes to our St Vincent's Curran Foundation family of very generous donors. Your generosity strengthens the hospital's capacity to care for our patients and safeguard the health of our community, especially when it's needed most. As you've heard tonight, Philanthropy has truly played a profound role in the expansion of our Haematology and Cellular Therapies program. From the very early days of the Bone Marrow Transplant unit to the $7.3 million refurbishment of our Haematology and Bone Marrow Transplant ward into a 24 single-bed isolation room facility, which minimises the infection of risk for our very immunosuppressed patients, to the more than $7.7 million that's been donated to expand our research and clinical trials program just in the last 6 years. This is really enabling many of the stem cell innovations that you've heard about tonight. While there's lots and lots of really generous supporters to these programs, I would really like to acknowledge once again Dr. John Chong and Mrs. Anne Chong for their incredible support, James and the late Amelia Simon for their generosity, the Politis family, MS Australia, the estate of Veronica Ferris, the Naloon Foundation, our friends at the Arrow Foundation, the Wade family, the Bourne Foundation, the Medich Foundation, the Delta Goodrum Foundation, David and Pippa Beek, who are here with us tonight, Tour de Cure, the Pace Foundation, the Heritos family, Dr. Joanne Joseph and her late sister, Maureen Joseph, Marianne Armstrong, in honour of her sister Margaret, and of course the Guth family, who are also here tonight. We're delighted to acknowledge Taylor's Wines for their support of Inside St Vincent's, and I hope you managed to enjoy a glass before tonight's conversation. A big thanks to our St Vincent's Curran Foundation team. Chris Lewis, thank you, Chris, for all of your efforts to plan and lead this wonderful event, and of course to our exceptional events team, Juan and Flavia, for their once again seamless implementation of tonight's activities. On behalf of St Vincent's Hospitals and the St Vincent's Curran Foundation, thank you all for coming here tonight. To learn about how you can support more, please reach out to one of the foundation team. There's a few of us here tonight. Obviously, you can visit our website as well at supportstvincents.com.au. Good evening and thank you very much.